The state's opioid problem is being called a crisis by some of the state's top officials.
Well, we certainly characterize it as a crisis. We certainly do.
Mental Health Commissioner Lynn Bashir knows that this crisis affects people like Ebony Vaughn. Vaughn is seeking treatment with addiction from the Council on Substance Abuse, or COSA. She's doing it, she says, to save her own life.
Overdose is an all of a sudden thing. You're used to being around your friends that you get high with and every day and partying, and you don't realize that it could be over that instantly.
She has now surpassed 100 days of recovery from a number of drugs.
Percocets, crack cocaine, alcohol, Xanax.
Sharita Finch is the executive director of COSA. It's one of many partially state-funded recovery programs.
Helping them to address some of the needs that are pretty general, such as housing, employment, something as simple as helping someone get their birth certificate or state ID.
Finch sits on the governor's opioid overdose and addiction council, where she says they're bringing different groups together.
From law enforcement to your medical provider, to your education systems, to your health systems, the conversations are taking place.
One of the issues the council is looking at is doctors who issue too many prescriptions.
Of course, we have seen some cases where some licensed physicians have really turned this into a profession, frankly, and are being arrested and jailed for that behavior, as they well should be. But most doctors are not like that, and they want their patients to get the treatment they need and to feel better in the recovery process.
Next year, the state's opioid response budget will see a decrease from $20 million to $13 million. The council will deliver their report to the governor on December 31st, and from there, we could see legislation regarding the opioid response in Alabama. Reporting in Montgomery, Rashad Hudson, CBS 42 News, local coverage you can count on.